Hi everyone, thank you for checking back in. This is day 9 of the Roux NY liver shrinking diet that I'm on for the 2 week period. My name is Dave Fortin. I am going for gastric bypass May 21st, which is in 6 days. I will be having the surgery. I am so excited. Um, just a couple of quick notes here. Don't want to take up too much of your time. I did get the medical clearance from my doctor, which is great. They also told me that I am borderline diabetic, which I always kind of figured that I was, but it was never actually said clinically or medically by a doctor before. So, how they diagnosed that was he said, your sugar is really high. Um, are you on the liver shrinking diet now? And I was like, yeah, I am. So he was like, well, that really doesn't have a lot of sugar. And so I told him what I was eating. And so he's like, your sugar level is really high. It's like, I don't know how the sugars work, but it's like 119, which is a borderline diabetic, I think, because diabetics run at like 126 or something of that nature. Whatever that equates to in medical terminology, I have no idea. So anyway, that's what he told me. And so he said that that will probably change after the surgery, fingers crossed. I also told him that I get severe migraines, which is another thing that I didn't really talk about, but that's something that happens too. I have a deviated septum on top of it, so that should also, my nasal passage and things clearing up for me breathing should also help after the surgery. So I'm really praying that it does, which would be fantastic. I'm hoping that it'll also help my singing voice as well, which would be really great. I'm a little nervous about getting the endoscopy, though, for the day of the surgery. I found out they have to stick another tube down my throat, which this would be the second time they had to do that now. The first time I had an amazing nurse do it, or maybe the doctor did it, I don't know, I was passed out. Because they knock you out to do that, and I didn't feel anything. I woke up after the anesthesia, and I was ready to go, which was crazy. That's another part of the process that you have to go through. I haven't gone through all of the steps with you guys as far as what it is, but for me it's been a now 7-8 month process of the constantly seeing the doctors and going for lots of blood work, lots of EKGs, and just checking a whole bunch of different levels through the Lehigh Valley Health Network. That's where I'm going. They're very thorough, very great people. I've had very positive experiences through them, which is fantastic, and I really appreciate that. The one thing that I did want to talk about too is the difference of gastric bypass versus the gastric sleeve. For those of you interested in the gastric sleeve, so I am not a doctor, obviously, so what I will just tell you is some feedback that I've heard and feedback that I've experienced through people that I know who have gotten that versus the gastric bypass. And some information that I've looked up online, obviously. But so the general consensus that I've seen is that the people who have gotten the gastric sleeve, wish that they would have gotten the gastric bypass. And the people who have gotten the gastric bypass say that it is the best decision that they have ever made, which is huge. The people who have gotten the gastric sleeve, there is a 5% of those people, 0.5. I forget exactly what the statistic is, so I won't I won't quote any more numbers. But there's a high percentage of the people that gain. Oh, I'm sorry, it's 50%. Now I remember, 50% of the people, and I double checked with the doctors. I had 4 surgeons. I will tell no, 3 surgeons and 1 doctor. That I verified this with. So 50% of the people who end up getting gastric sleeve will end up gaining most, if not all, of their weight back a lot faster or in general. So all in all, though, you just need to watch what you're eating in general. You're still going to lose a lot of weight. I think it's 70% or up to 70%. No, I'm sorry, up to 60% of your body fat that you'll lose from the gastric sleeve. From the gastric bypass, you're going to lose 70 to 80%, which is astonishing. That's crazy. So right now, again, I'm currently 290. Well, I was 297. I'm now 290. I lost 7 pounds through the liver shrinking diet. So I will be dropping down to somewhere between 165 and 180 after the surgery is over, and after the couple of months have gone by and my body readjusts to everything. The people who have gotten the gastric bypass, however, they generally keep their weight off, which is it was a huge factor in deciding which one I was going to get. Honestly, I was going with the whole gastric sleeve the entire time, and what actually caught my attention was somebody had asked me why I was going for the sleeve as opposed to the bypass. And I was like, oh, well, I feel like it's a little safer, which it is. It's a little bit easier on your body, which it is. I'm still going to see all these amazing results out of it. And then they were like, well, honestly, I really would look into that a little bit further. Now, I had looked for many years already, and I had thought that I completely understood the two differences. However, when I looked a little bit further after some people giving me some information, I was looking at like which one is better for you, the bypass or the sleeve, and which one you lose weight more, bypass or sleeve, but I did not look at the other effect, whereas, what happens to people after the surgery, where after, say, a year or 2 years has lapsed, and how much weight they've gained back. That was something I didn't even think to look up, rather. So, if I were you and you're going for it, you might want to do that also, but this is the general information that I found. So, I will tell you some of the experiences that I had when I first started this process. So, I went to my first surgeon. He was a very nice man who told me that if I were his brother, he would recommend getting the gastric sleeve because it is the safer alternative method so that I can still use this tool that they're giving me to lose a bunch of weight. It was healthier, it was easier on my body, I could recoup faster, etc., etc. So I was like, okay, that's what I'm going for. Well, then that doctor ended up moving away and was replaced with a secondary doctor. So who was the surgeon? Well, the second surgeon. So the second surgeon, I was telling him that I'm going for my gastric sleeve, and then he said, in either direction, we're going to support you. So if you want to get the sleeve or you want to get the bypass, I always tell my patients that it's up to them what they decide, and we will go from there. So I was like, okay, great, I'm on the right path, I'm doing everything I'm supposed to be doing, I'm following the regimen, etc., etc. So I'm really doing this, I'm going for the sleeve. So then, after I talked to some people and they're like, listen, you really need to just check out going for the bypass as opposed to the sleeve, I was like, you know what, let me do more research. So I did, and then I approached my doctor and I was like, I think that I want to do the surgeon, I want to do the gastric bypass now instead of the gastric sleeve. I feel like I'm going to get more results from that, and that I'm mentally prepared. I'm not nervous about anything for the surgery. I really want to do this. So he, obviously asked me what the reason was for my change and why I felt that I needed to do this. And so I told him everything that I was feeling, everything that I researched, people that I talked to. I have all these things on my shirt. I didn't even realize I'm growing another cat on me or something. But anyway, sidetracked. And so, again, he told me, we're going to support you no matter what you do, what you want to do. It's the bypass or the sleeve, and either way will be okay. But we don't do the sleeve, we don't do the bypass here. So you have to go to Allentown. And I'm like, okay. So I went to Allentown. I met with a third surgeon now, who in turn told me, well, why were you even thinking about going for the bypass to begin with? The sleeve to begin with. You should have just gone for the bypass. As a surgeon who has seen many people and have done hundreds of surgeries, I would have told you right out of the gate that you should be getting the bypass and not the sleeve. And I'm like, well, that's interesting, because I went from one extreme to the next. So then I checked in with my doctor to do the medical clearance, which was a couple days ago, and my doctor said to me, I was going to mention this to you before when you told me you're doing the bypass, but I let my patients do what they want to do, but honestly, I would have recommended, the sleeve rather, he's like, but honestly, I would have recommended you doing the bypass instead of the sleeve. And I'm like, why? And so then he proceeds to tell me everything that he thought of that the same surgeon in Allentown told me. And he was like, I'm really glad to actually see that you're going for the bypass now. And I'm like, okay, well, that's great. So I was very happy to hear that both my doctor and the surgeon approved of the exact same thing, and that my thoughts and opinions that I got from other people and my research and everything that I was done, realized that it was the healthier option and better option for me. So I'm not going to have any more back pain after this. Well, these are all the things I'm told I'm not going to have. Back pain, knee pain, regular joint pain, the neck pain where I'm constantly cracking my neck all the time. I'm going to be able to breathe better. This won't be here, so it won't be choking me at night, so I'll finally be able to breathe, thank God. So it'll also clear up some of my nasal passage. My acid indigestion, acid reflux is going to go away. My migraine should go away. My high blood pressure should go down. Just so many things that are going to change after this surgery. And I cannot tell you how excited I am to not be in pain anymore. And I don't really tell too many people about my pain, but I feel like this is an open forum and a platform for me to do it. And those of you who are experiencing this know exactly what I'm talking about, who are prepping to get ready, and you have all these aches and pains that you just want to go away, so you're popping all these NSAIDs constantly to try and get rid of that. And it's not a good feeling, and you would give anything at that point to just you feel normal, feel like a human that doesn't have pain. And I'm not going to say that I'm never going to get it again, but I won't get it in the same fashion. So I'm really excited to experience all of that. I'm not nervous at all. I actually booked my hotel stay right now I have it for 2 nights. One of my friends is going to come with me, which is fantastic, so I won't feel alone. He's going to stay in the hospital with me, which is great. And I love that support system, which is good too. I'm actually going to be picking up a couple of different things too that I'm going to show you guys. Some things that I've seen from other YouTubers and from online, things that people have purchased beforehand. Things such as, like bringing a game system, or like baby foods, or Gastric, or maybe like a drawing pad, just things to keep yourself busy. The surgeon initially told me I'm going to be so inundated with students coming in to see me after my surgery, and doctors and nurses and everybody checking up on me for all these different things, that I'm going to be so inundated with all of that right after the surgery that I'm not going to have really time to like read a book. When I talk to the people who have had the surgery before, and then when I see other YouTubers, they all tell me that, sure, that might happen in the beginning or half the way through the day, etc., but later on at night when you're just laying there and you have nothing to do, these are the things that you want to have with you, so at least that you can keep yourself occupied until you fall asleep. So, I plan on bringing lots of your normal things like your cell phone charger, the cord there, like maybe a game system or something, or a book or something to draw with. If you have games on your phone, if you don't have games on your phone, download them, use them. They will help you get through your night, which is what I'm hoping they're going to help me do. Just anything that would help you, is my point. So, I did a lot of rambling, but I feel like that was a lot of really useful information for anybody who is also going for this. If you guys have any questions about anything, like I always say, please feel free to comment. You can follow me. You can like my videos. I am not posting them on Facebook, but I will be posting them on Facebook probably soon. So just follow along. Go back, read through, see some other things that I've said. Maybe I've missed a couple of things along the way, but I'm going to try and keep you guys as posted as I can. One funny note, I always notice that every time I record videos, with the exception of the first one, I'm in my car. It's because I literally have no time in my life besides being in my car right now. So, if I have time in the evening, I'm very fortunate. Usually after working, I get ready, come home, go to bed. So, here I am in my car recording all of these videos for you guys. So, I hope that you enjoy. Please stay tuned. I will see you tomorrow with another video for day 10. Alright, take care guys. Have a great day. Bye-bye.